Welcome to the video. Test your nursing knowledge and pass your NCLEX exam. This covers everything from medical surgical nursing to maternity. Now, let's get started. A young adult who was in a motorcycle accident is brought to the emergency room with a closed head injury with suspected subdural hematoma. Although the client complains of a severe headache, he is alert and answers questions appropriately. The nurse would question which of the following orders. 1. Promethazine, Phenergan 25 mg IM3H. 2. Morphine sulfate 10 mg IMQ34H. 3. Docusate sodium Collis 50 mg PO bid. 4. Ranitidine, Zantac 50 mg IVPBQ12H. The correct answer is 2. Narcotic analgesics, causes CNS and respiratory depression, contraindicated in head injuries. The nurse has just returned to the desk and has 4 phone messages to return. Which of the following messages should the nurse return first? 1. A woman in her first trimester of pregnancy complaining of heartburn. 2. A man complaining of heartburn that radiates to his jaw. 3. A woman complaining of hot flashes and difficulty sleeping. 4. A boy complaining of knee pain after playing basketball. The correct answer is 2. Indicates chest pain, needs to seek medical attention immediately. A patient is admitted to the surgical unit with a diagnosis of rule-out intestinal obstruction. The nurse is preparing to insert a Salem sumping tube as ordered. In which of the following positions would it be best for the nurse to place this patient during the procedure? 1. Head of bed elevated 30 degrees to 45 degrees. 2. Head of bed elevated 60 degrees to 90 degrees. 3. Side lying with head elevated 15 degrees. 4. Lying flat with head turned to the left side. The correct answer is 2. Facilitates swallowing and movement of tube through GI tract. 3. Not the best position. The nurse is monitoring the fluid status of a 63-year-old woman receiving IV fluids following surgery. Which of the following symptoms would suggest to the nurse that the patient has fluid volume overload? 1. Temperature 101 degrees Fahrenheit, 38.3 degrees Celsius, BP 96/60, pulse 96 and thread. 2. Cool skin, respiratory crackles, pulse 86 and bounding. 3. Complaints of a headache, abdominal pain, and lethargy. 4. Urinary output 700 cc 24H, CVP of 5, and nystagmus. The correct answer is 2. Will see bounding pulse, elevated BP, distended neck veins, edema, headache, polyuria, diarrhea, liver enlargement. A woman has been recently diagnosed with systemic lupus and shares with the nurse, "I am thinking about getting pregnant, but I don't know how I will be able to tolerate a pregnancy since I have lupus." Which of the following responses by the nurse is best? 1. Most women find that they feel better when they are pregnant. 2. How long have you been in remission? 3. Women with lupus frequently have slightly longer gestations. 4. It is best to become pregnant within the first 6 months of diagnosis. The correct answer is 2. Should be in remission for at least 5 months prior to conceiving. The multidisciplinary team decides to implement behavior modification with a client. Which of the following nursing actions is of primary importance during this time? 1. Confirm that all staff members understand and comply with the treatment plan. 2. Establish mutually agreed upon, realistic goals. 3. Ensure that the potent reinforcers rewards are important to the correct answer is 1. To implement a behavior modification plan successfully, all staff members need to be included in program development, and time must be allowed for discussion of concerns from each nursing staff member. Consistency and follow-through is important to prevent or diminish the level of manipulation by the staff or client during the implementation of this program. A client received 6 units of regular insulin 3 hours ago. The nurse would be most concerned if which of the following was observed. 1. Small respirations and diaphoresis. 2. Anorexia and lethargy. 3. Diaphoresis and trembling. 4. Headache and polyuria. The correct answer is 3. Regular insulin peaks in 2 to 4 hours, indicates hypoglycemia, give skim milk. The nursing assistant reports to the nurse that a client who is 1 day postoperative after an angioplasty is refusing to eat and states, "I just don't feel good." Which of the following actions, if taken by the nurse, is best? 1. The nurse talks with the client about how he is feeling. 2. The nurse instructs the nursing assistant to sit with the client while he eats. 3. The nurse contacts the physician to obtain an order for an antacid. 4. The nurse evaluates the most recent vital signs recorded in the chart. The correct answer is 1. Assessment required, monitor for closure of vessel, bleeding, hypotension, dysrhythmias. The nurse prepares a 25-year-old woman for a cesarean section. The patient says she had major surgery several years ago and asks if she will receive a similar shot before surgery. The nurse's response should be based on an understanding that the preoperative medication given before a cesarean section, 1. contains a lower overall dosage of medication than is given before general surgery. 2. Contains reduced amounts of sedatives and hypnotics than are given before general surgery. 3. Contains reduced amounts of narcotics than are given before general surgery. 4. Contains medications similar in type and dosages to those given before general surgery. The correct answer is 3. Decreased so less narcotic crosses the placental barrier, causing respiratory depression in the infant. The nurse is caring for an 11-year-old patient being treated for a fractured right femur with balanced suspension traction with a Thomas splint and Pearson attachment. The nurse notes that the patient's left leg is externally rotated. The nurse should 1. Place a trochanter roll on the outer aspect of the thigh. 2. Perform resistive range of motion of the left leg. 3. Adduct and internally rotate the left leg. 4. Instruct the patient to maintain the left leg in a neutral position. The correct answer is 1. Holds hip in neutral position and leg in normal alignment. Entire weight of leg cannot be held by props placed below knee. The nurse is preparing a 5-year-old child for surgery. The nurse notes that the child's parents are divorced and have joint legal custody. The informed consent for surgery has been signed by the mother. Which of the following actions by the nurse is best? 1. Notify the physician. 2. Inform surgery. 3. Contact the father to obtain consent. 4. Continue the child's preoperative preparation. The correct answer is 4. Parent or legal guardian required to give informed consent prior to surgical procedure. The nurse is caring for clients on the neurology unit. What would be the most appropriate action for the nurse to take after noting that a client suddenly developed a fixed and dilated pupil? 1. Reassess in 5 minutes. 2. Check the client's visual acuity. 3. Lower the head of the client's bed. 4. Contact the physician. The correct answer is 4. Implementation. Fixed and dilated pupil represents a neurological emergency. A mother brings her 2-year-old boy to the pediatrician's office. Which of the following symptoms would suggest to the nurse that the child has strabismus? 1. When the child draws, he places his head close to the table. 2. The child rubs his eyes frequently. 3. The child closes one eye to see a poster on the wall. 4. The child is unable to see objects in the periphery of his visual field. The correct answer is 3. Visual axes are not parallel, so the brain receives 2 images. A client is given morphine 6 mg IV push for postoperative pain. Following administration of this drug, the nurse observes the following: pulse 68, respirations 8, BP 168, client sleeping quietly. Which of the following nursing actions is most appropriate? 1. Allow the client to sleep undisturbed. 2. Administer oxygen via face mask or nasal prongs. 3. Administer naloxone Narcan. 4. Place epinephrine 1 to 1000 at the bedside. The correct answer is 3. IV naloxone Narcan should be given to reverse respiratory depression. Respiratory rate of 8 is too low and necessitates a nursing action. The school nurse is teaching a group of preschool mothers about poison prevention in the home. Which of the following statements, if made by a mother to the nurse, indicates that further teaching is necessary? 1. I should have a bottle of Ipecac for each of my children. 2. I should induce vomiting if my child swallows lighter fluid. 3. Giving my child water or milk may help dilute the poison. 4. Proper storage is the key to poison prevention in the home. The correct answer is 2. Vomiting contraindicated when child ingests hydrocarbons due to danger of aspiration. The nurse is caring for a manic client in the seclusion room, and it is time for lunch. It is most appropriate for the nurse to take which of the following actions? 1. Take the client to the dining room with one-to-one supervision. 2. Inform the client he may go to the dining room when he controls his behavior. 3. Hold the meal until the client is able to come out of seclusion. 4. Serve the meal to the client in the seclusion room. The correct answer is 4. Should eat at regular time, remain in the seclusion room for client's safety. Which of the following nursing actions has the highest priority for a teenager admitted with burns to 50% of his body? 1. Counseling regarding problems of body image. 2. Maintain airborne precautions. 3. Maintain aseptic technique during procedures. 4. Encourage peers to visit on a regular basis. The correct answer is 3. Safety is a priority for the client who is at high risk for infection. 4. Psychosocial, important for an adolescent, but is not highest priority. The home health care nurse is caring for a 30-year-old woman with type 1 diabetes mellitus. The client has been maintained on a regimen of NPH and regular insulin and a 1,800-calorie diabetic diet with normal blood sugar levels. Morning self-monitoring blood sugar (SMBG) readings the past 2 days were 205 mg per deciliter and 233 mg per deciliter. The nurse expects the physician to 1. Reduce the client's diet to 1,500 calorie ADA. 2. Order 3 additional units of NPH insulin at 10 p.m. 3. Order an additional 10 units of regular insulin at 8 p.m. 4. Eliminate the client's bedtime snack. The correct answer is 2. Dawn phenomena. Treatment is to adjust evening diet, bedtime snack, insulin dose, and exercise to prevent early morning hyperglycemia. That's it with this video. Check out the website for more free nursing test bank questions. Thank you for watching.